So, I'm going to talk about current follow-up strategies, new possibilities, and then talk to you about our PETNEC2 program. Firstly, why are we doing follow-up? Well, because early detection of recurrence improves outcomes. As you can see here from the Goodwin paper, 2001, if you have an early recurrence of a stage 1, much better outcome than a stage 4 at recurrence. Most recurrences we know happen within the first 2 years and certainly within the first 3 years, and also the complications of treatment tend to plateau by second or third year. So it makes sense to have kind of follow-up within the first 3 years and maybe the first 5 years. And so a lot of, and this is a table of different follow-up strategies, UK, America, Denmark, Scandinavia, and as you can see, they're pretty similar. About 2 monthly for the first 2 years, and then 3 to 6 monthly for the years 3 to 5. But there are challenges with this current follow-up strategy, and I'm going to go through the main challenges. Firstly, it's quite resource intensive. If you look at those strategies, there are going to be 20 to 26 visits in the first 5 years, and that's if they don't have any problems. If they have a problem like a suspected recurrence, then they have a scan, and then they come back again, and so on. So it's quite resource intensive for every patient. The second thing is that we are, certainly in Europe and America, getting increased numbers of patients. This is one of our papers showing numbers of head and neck cancer patients in the UK, and as you can see at the very top there, that's overall numbers. But you can see the one in red that's going up very high, especially for males, and that is oropharyngeal cancer. And oropharyngeal cancer is really causing a big jump in numbers in head and neck cancer patients in Europe and America. At the same time, it's really good that a lot of these patients are doing much better. So they have much better survival. You know, we used to have a survival of 50% with the oropharyngeal patients. It's 75, 80% as a total, and the low-risk ones are doing really, really well. So that means that a lot more patients are surviving treatment. And if you put those two together, increasing numbers with longer or better cure rates, that means a much higher disease population and a disease burden and a lot more patients in follow-up. Also, the current strategies aren't efficient. So if you look at the rates of detection from these follow-up strategies, it's 1